It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
Our next guest, Dr. Olav Jaren, talking about dementia. Shannon, this is something that a lot of us contend with, either ourselves or somebody we know and love.
Oh, you're exactly right, Tom. You are not going to get through life without knowing someone. Maybe it's a loved one, a family member, a relative, or neighbor, but dementia is very prominent out there, and we're going to talk about what it is and maybe how you can help delay it, those things.
All right, here's Dr. Olav Jaren and Shannon O'Kelly.
Dr. Jaren, welcome to Health Talk. How are you?
I'm fine. Thank you for having me.
Yeah, thanks for coming back. I think you came on, several years ago, but we're excited to have you back. You know, I always want our listeners to kind of get caught up with our guest on what they're doing, what their practice looks like, maybe their background, some of their areas of expertise, and maybe their passion in their practice, so to speak. Maybe just take a minute here and tell our listeners maybe some educational background, how you became involved in what you do on a daily basis, and maybe what you do on a daily basis. And then we'll get into our topic, which today is going to be dementia. So give us a little background on Dr. Jaren.
All right, sure. Thanks for having me again. I enjoy these very much, and I appreciate having a chance to reach out to people. I am a neurologist at Overlake, and I do what's called general neurology, which is a mixture of all the neurology subspecialties. In any given day, I see people who might have a memory concern or an illness that affects their memory, like dementia, or a cause of numbness, like carpal tunnel syndrome, or a nerve pinched in their back, or headache disorders, or a tremor, or all sorts of things.
Yes.
Sometimes
go ahead.
Sometimes other things too. Sure. Go ahead. I trained at Michigan for my residency. And I've been in practice, I guess this is my 16th year of practice.
Okay. Well, let me take you back 16 years when you were training. You know, you picked an area of study that the nervous system, neurology. I remember going through physical therapy school when we did neuroanatomy and neurophysiology. It's a challenging area. It's very complex. Why this area for you? What drew you to be a neurologist?
Well, I think I like thinking about how the nervous system works. And when it's not working for someone, I like to explain how it should work and what might have gone wrong. And I especially like finding ways to help people fix the problem. I especially like that. Yeah,
it's an area of our health, I think, generally speaking. You know, I think we just take our nervous system for granted because generally speaking, it works pretty good. And it works good for works good for a long time. But boy, I tell you, when it stops working for whatever reason, I mean, boy, that really affects the patients, not just patients, but families, relatives. And one of the things that we're seeing a lot in medicine and out there in the public with people is dementia, and it can be very challenging for everybody involved. Maybe you can tell us a little bit about dementia. I know it's very complex, but let's talk about dementia.
Yeah, there are a lot of good questions here on this subject. Dementia is an illness that affects the brain. There are a lot of different kinds of dementia, and maybe we'll get into that in a second, but dementia is an illness that affects the brain and impairs a person's memory, orientation to time and place, problem-solving skills, organizational skills. And dementia is a progressive disorder. It means it gets worse over time. And it is usually a very difficult to treat and profoundly disabling illness.
Yeah, you mentioned there's different types, but before we talk about different types, maybe we can do some neurophysiology here for our listeners.
Okay, sure.
Essentially, you know, dementia is caused by dying nerve cells. I'm just throwing some stuff out here. Help us understand what is causing dementia.
Yeah, that's a good point. With dementia, a person has loss of brain cell function in many different parts of their brain. These could be parts of the brain that affect their vision, or maybe how they plan things or how they use their language. Either they understand language or make words or find their words. There are little areas of trouble all over the brain. There are, in certain types of dementia, there may be more problems in one area compared to another. But unlike other neurological illnesses, like let's compare dementia to Parkinson's, traditionally there are a lot of symptoms of tremor or muscle rigidity. In dementia, we don't necessarily see that.
More with Shannon O'Kelly and Dr. Olav Jaren next on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
More of our conversation now with Dr. Olav Jaren and Shannon O'Kelly talking about dementia.
Dr. Jaren, again, thank you for joining us. Health Talk. Thank you for talking to us about dementia. Obviously, it's very prominent. I'm not sure anybody out there is going to get through life without having a relative or a friend or someone that experiences it. You talked about what's going on. Do you know what triggers it?
So you're right. It's very common. Dementia has been a common illness really forever. It's much more common for people who are very old, so let's say over 85. Not everyone who's older gets this, but it's more common as we age. It is also common with certain medical illnesses, like let's say if we have a lot of trauma to our brain, if we've had a lot of illnesses to our brain, maybe illnesses that affect our liver or kidneys, our blood pressure or blood sugar. These factors can not guarantee, but maybe would increase the chances of developing dementia down the road. That's sort of one answer.
That's a good answer, and that makes a lot of sense. I mean, what you describe is kind of what I'm hearing also. Tell us about the different types.
Well, yeah, sure. So one thing is, it is true that people who are very young can develop dementia. I would say that is rare. For most of us, it's unusual to develop dementia before we're age 60, 65. That's not common. Now, on the other hand, there are many different types. I think all of the listeners will recognize that Alzheimer's disease is one type of dementia, and a lot of people ask me whether they are the same thing. You could say that Alzheimer's disease is a type of dementia, and it is arguably the most common type of dementia. Maybe it accounts for about 50% of all dementia cases. But we also have dementia related to, say, Lewy body disease, which is relatively unusual, but people may have heard of this. There's frontal temporal dementia. There's dementia related to, say, alcoholism, or dementia related to stroke. We call that vascular dementia, for example. And then there are some other less common types, maybe related to other medical illnesses. But that is a brief overview of many types.
That's very interesting. How can we help ourselves maybe prevent this or delay it? Yeah, let's talk about prevention.
We have maybe not all the answers, but I can tell you what we know as of now. Okay. We know that a healthy lifestyle that involves good nutrition, a lifestyle that has regular exercise like walking, making sure that we have restful, healthy sleep, going to the doctor for those preventive health checks, and making sure that we don't have high blood pressure or that we don't have elevated blood sugar, and if we do have them, that we take care of them. Those things are really helpful for preventing dementia.
Yeah, that's really interesting. You know, I think what we're seeing in medicine right now, which I'm really excited about, and here at IRG Physical and Hand Therapy, one of the things we're focusing on is what you just talked about, is really incorporating lifestyle medicine.
Absolutely. Physical therapy, for example, is very important for maintaining our physical abilities and fitness, ability to walk or do other activities, exercise. When we lose those abilities, it is really tough on us, and it affects our brain.
Oh, absolutely. I mean, socialization. I mean, if you just look at people sometimes that lose, a spouse and have lack of socialization in the brain dysfunction or deterioration. You know what? I want to have you back on. For right now, I want to say thank you for joining us at Health Talk. Look forward to talking again. Have a great afternoon.
You bet. Thank you.
You've been listening to Dr. Olav Jaren, neurology doctor at Overlake Medical Center. Overlakehospital.org has more information. And this is something we all contend with at some point in our lives. So if it's not us, it's somebody we know or love.
Oh, absolutely. I mean, it is around us, and it's, again, very prominent. But the good news is there's options to help family. And Dr. Jaren is doing a wonderful job with these patients.
Absolutely. Great to hear from him. We'll be back with our final segment after this time out on Northwest News Radio.